Welcome to today's Coffee with Carrie. I want to just talk a little bit about what is telemedicine. We get a lot of questions from healthcare professionals, hospitals, anyone that is seeing patients on really, what does it mean to provide telemedicine and should they be directing patients to the telemedicine providers through their insurance company? Should they be providing telemedicine directly to patients? And so I wanted to just back into a couple categories and talk a little bit about some of the options on really increasing that patient experience and being able to provide telemedicine. There's a lot of current, depending upon your state, billable codes that cover video telemedicine and video telehealth. And that's why you have seen kind of the increase in the awareness. Maybe some of your executives at your company are asking you to look into a telemedicine or a telehealth platform. And it really boils down to a few things I want to cover today. Number one, keeping that patient experience and keeping your patients and providing them the convenience to be able to connect to a doctor, that through whether it's your practice or your hospital group, whatever it may be. More and more patients, given work schedules and convenience and so forth, want to be able to connect to you through video and reduce the drive time, reduce taking off work, things like that, and even reducing ER visits and things at night. We have a ton of clinics now by city that are popping up on every corner, and your millennial demographic doesn't go to a regular doctor or have a lot of allegiance to a doctor like maybe your baby boomer or Gen X demographic who has had the same doctor for 20 years, 30 years, whatever it may be. And so being able to provide that, really looking at the billable codes, there's a lot of billable codes that are available today. There's a whole slew of billable codes that are coming out in January of 2019 that Medicare and Medicaid are covering these types of visits, in addition to a lot of the insurance carriers already cover these types of visits in regards to follow-up care, prescription refills, things of that nature. And so when you think about, what is telemedicine, what is video telehealth, it really comes down to getting a platform, a technology that allows you to be able to instantly connect to your patients, whether it's at a scheduled appointment time or whether it's some type of routing for after hours to talk to some doctor within the practice. And what you really need to be thinking about is, are you going to provide the doctors through your practice or through your hospital group, or are you need to supplement that with other doctors? And that really gets down to when choosing a telemedicine platform. That's kind of one of the key decisions, right up front of, do you need support from other groups and, kind of pool of doctors and you're willing to take a small percent of that revenue, or are you going to man it with your own doctors and be able to, kind of bill that own amount? So really when you're thinking about a video platform, you need to think of a few things for consideration. Number one, that, and then number two, if it's going to go to kind of a next available doctor or 5 or 6 doctors in the evening, whoever's on call, there could be multiple doctors on call. You need to think about video routing and the ability for multiple people to be able to pick up a video call, very much like kind of a virtual ER, virtual after hours. Kind of think you're old school, who has the pager tonight, but done through video. Or are you just going to use it to schedule appointments? Some people are using things like Zoom and things like that. That really doesn't, while it's kind of good for smaller 1 to 2 practice doctors, it's not really scalable in the sense of, somebody has to download Zoom, you have to have, open up a meeting room, and there's kind of a lot of back and forth similar to Skype. So when you're thinking about, a telemedicine or a video telehealth platform, those are some key things that you might consider. That's your today's Coffee with Carrie.